Hello, good evening. My name is Dr. Trudy Ufondo of Snowspirations Global Health Solutions. Thank you and welcome to this episode of YouTube Live. And today is a very, very interesting topic. Today we're going to look at the concept of leakage of semen or ejaculate shortly after lovemaking. Is there any connection between the visible leakage of semen, which can be mistaken for sperm, okay? So we're going to look at it from, a holistic approach. Can that lead to delay in your ability to become pregnant? Is there any connection between that and your ability to become pregnant? I'm going to use my good friend to illustrate. So I'm going to show a couple of things you need to be conversant with. At the end of today's teaching, you will be in a better position to know what you should worry about. So what I've noticed, if you are not forthcoming regarding starting your family, when stress creeps in, you begin to focus on things that don't even matter. Now, this leakage of semen from the vagina, it's one of the things that should not matter because it doesn't really affect your ability to become pregnant. Okay, so that's what we're going to discuss in the next few minutes. I just want you to give me a few minutes. Then after that, I'm going to take care of your questions. Okay, so let's start. So in actuality, leakage of semen. First of all, we need to know the difference between semen and sperm. They are not the same thing. What you visibly see at the peak of sexual intercourse when you ejaculate is called semen. Now, semen is composed of so many fluid. Sperm is less than few percentage of the whole component of the semen. So there are so many things that make up what you actually see. Sperm, it's not visible to the unaided eye. You can only see the sperm under the microscope. So it's completely normal for some of the ejaculate to escape from the vagina after sexual intercourse. Completely normal, completely expected. Matter of fact, on a jovial side, the fact you're leaking semen, the fact you're leaking ejaculate means you actually have more than enough. Because what happens, this is the vagina. So this cylindrical structure is the vagina. This is the cervix. This is the gate. This is more like the toe gate. So when you ejaculate, this is where the semen will be allowed to be. Now, the semen that contains the sperm that will participate in reproduction would have been suctioned in. So there's a kind of pressure that will bring them into the womb. The overall aim of getting a woman pregnant is to make sure it bypasses the cervix. So once the semen that will participate, that contains the sperm, it's inside the womb, that's all we want. Now, by law of nature and by gravity, the remaining sperm will fall off. Remembering that the nature of the vagina is acidic. So the remaining sperm that will be remaining in the vagina will be attacked by the acidic environment of the vagina. So majority of the sperm that will be left in the vagina might not survive. But remember that the sperm is a very rugged cell because you can actually get your partner pregnant 5 days ahead of time if you're ovulating. But the sperm that will participate in the process of reproduction is already in. So you don't need to worry about this. So on a jovial side, if you have more than enough, if the remaining one it's not able to pass through, then it goes off. So it's actually a good thing to have something coming out of your body. It means that your partner actually has enough. But we don't necessarily look at the volume of what we see. We actually hunker down to look at what we call seminal fluid analysis. So the ability for you to become pregnant is based on the parameter of the sperm. We look at the count, we look at the motility, and we look at the morphology. So after the semen is released into the vagina, sperm immediately separates from other fluid components of the ejaculate and begins to move right past the cervix up into the womb. Once it gets to the womb, what's the role of the sperm? It will begin to find its way to the tube. When it gets to the tube, hopefully by then the egg would have been released. It will go to a place called the ampulla where fertilization will occur. So sperm moves into the tubes within minutes. So think about that for a moment. Within minutes, the ones that will participate will be there, hopefully waiting for the eggs to be released. The process of releasing the egg is simply what ovulation is all about. So once the ejaculate is inside the vagina, like I said, the vaginal secretion is very acidic. So it's going to attack the remaining sperm there. So you don't need to worry about this. If you are experiencing this and you're worrying about it from today moving forward, don't worry about it at all. Okay? Just relax. Most women will observe this. It's completely normal. Most women will be wondering, oh, is it likely the reason why I'm not able to become pregnant? There is no connection between the leakage of this ejaculate or the semen from the vagina and being unable to be a mother. They are not connected. So spare your energy towards other things. So what are the other components of the ejaculate? You can have fluid from what we call the seminal vesicles. The fluid that comes from the seminal vesicle contains protein and enzymes, which also help to nourish the sperm. Now, the ejaculate can also contain fluid from the prostate gland, which also helps to nourish the sperm. Some of the fluid can also come from what we call Cowper's gland in the urethra. And some can also, come from the testes. So the essence of all those other fluid is to aid the sperm, to make sure that the sperm will permeate through the cervix and get to the womb. So they are all aiding the sperm. So what you are losing when you come to reality is actually more of the things that are increased in number. Remember that the sperm is less than 10%. Less than 10%. So 90%, it's more than 10%. So no matter what you see visibly, you shouldn't be worried about that. So semen leakage from the vagina cannot stop you from becoming pregnant. They are not connected. Okay? It's completely okay. You're going to get pregnant so long as your partner has good parameter. So what do I mean? So long as your partner has at least good count and good mobile sperm. The motility index means we want a sperm that will be fast swimmers so they can easily swim past the cervix, get to the womb, then begin to go to the tubes. So whether you're seeing it visibly or is leaking like whatever you call it, there is absolutely nothing to worry about. Now, some people might tell you, oh, what can I do to stop this from happening? Should I stay in bed after 15 minutes or whatever? Truthfully, you don't need to do nothing. Look, I'm telling you the reality. Spare your time making love 48 hourly. Whether it's your feeling is coming out or not, don't worry about it. Now, for some people, for peace of mind, you might want to stay back in bed, a couple of about 15 to 20 minutes, just to, kind of give yourself a feeling that, you're doing something. So some people advise, staying back for 15 to 20 minutes after the act. But guess what? It doesn't really matter. There are even some women that will become pregnant with non-penetrative sex. So it depends on your own fertility index. If you're releasing your eggs, your hormones are okay, and all the parameters that will get you pregnant is okay, you don't need to worry about it. So if you ask me, bottom line, quick making much ado about nothing. So whether it's coming out, whether it's not coming out, you don't need to worry about it. So there is no connection between the visible escape of semen from the vagina shortly after sexual intercourse and your inability to become pregnant. Now, I know so many people might have called it so many names. So I know in Yoruba they call it a name. I know in Igbo they call it a name. And they begin to give you a couple of herbs. And, just think about that. There are certain things that happen in the body of a woman that you don't even need drugs. This is one of them. So don't worry about this. There are so many other things I want you to worry about. If you have post-seminal fluid analysis, work on changing your lifestyle, work on your BMI, work on your body weight, work on what you eat, avoid your stress, stop your alcohol, drink water. When you do this, your sperm will be of high quality. So the woman, stop worrying about this. When you worry about this, you're going to increase your anxiety level. You're going to increase the stress level. And when you're anxious and your stress level is high, it will affect your hormones. So on the long run, you don't need to worry about this. This is just the summary I want to give you this evening, okay? Now, I'm going to allow us to ask our questions, and we're going to quickly tackle the question, then we're going to get some break. Okay. How can you subscribe to Talk to Me? You are not on Facebook. Okay. So what you need to do, my sister, Our subscription is not just Facebook based. The reason why we concentrate more on Facebook is because our larger community is in Facebook. What you need, it's an email. Okay, so my admin is gonna shoot you an email. She's gonna share our official email. Send us an email. So long as you have a functional phone and you have your WhatsApp, the medium for communication right now is WhatsApp. Okay, so admin is going to share our official email. Shoot us an email. We'll share different packages. We have 1 week, 1 month, 3 months, 6 months, ANC and BFB. Then you decide the one you want. So once we get your email, we're going to send you that link. Once you pick your package, so long as you have WhatsApp, you can be communicating with us completely the way it should be. But right now, please ask your questions in real time regarding escape of semen. Remember the difference. I want our members to know the difference. There is a big difference between what you call sperm and semen. They are not the same thing. Sperm is 10% of semen. What you see visibly is called the semen. It contains other fluid. Sperm you can't see with your eyes. So some women will be wondering, oh, my partner's sperm is watery. It's no longer like pap. We're not really worried about whether it's like water. What we are worried about is the content of what you have. Okay, so content is king. Okay, so please ask your questions in real time and I'll provide you feedbacks in real time. The clinic is open. It's now time to ask your questions and I'll provide you feedbacks. What you can encourage your partner to do, if you guys are having problems, I want you to focus on the number 35. So if you as the woman is 35 years and above and you guys are practicing PPP, that means you believe in God, you pray every day, you play every day if you can, but our recommendation is 48 hourly. So that means if you meet your partner today it's Thursday, tomorrow Friday, have some break, continue Saturday, have break on Sunday, continue Monday. So you skip every other day. If you can do this and you believe in God and you have faith, if you are above 35, once it's 6 months, you escalate. What do I mean by escalating? You begin to seek help from a fertility specialist. We don't want any of our members going beyond 1 year cumulatively. Once you are ready to start your family, once it's 1 year gap, we begin to get worried. Now, the question is, what do you do when you and just look for pity party? If you don't act properly, you might be in the same spot. So worrying is good. Worrying will make us to do the right things, make the right decisions, especially September. So do you have someone helping you? Because in life, when you've done your best, you can always seek help. Okay, so please ask your questions. If you have any question, please ask so I can give you feedbacks. Okay, do you have any questions? The clinic is open. It's interactive right now, so feel free to ask your questions. I'll give you a feedback. This is a cause of concern for some women, and I'm telling you this evening, there is absolute, so long as you have your eggs, so long as your partner has his own sperm, you're going to get pregnant. Now, the difference between a woman and a man is actually like day and night, because men produce their sperm every 3 months, but women have their eggs fixed. So when a man modifies his lifestyle, if before the upcoming 3 months, he's able to work on his body weight, he's able to stop drinking, he's able to drink water, he's able to sleep, he's able to eat a lot of vegetables and a lot of fruits, he can improve his sperm quality. But for the woman, unfortunately, you don't have that liberty, because you're coming into this world with all your eggs. Your eggs are completely intact, but they are sleeping in your ovaries. So every month we go and wake them up. We allow one to grow and become dominant follicle and burst. So the release of that egg is simply what ovulation is all about. Now, as a woman, as you're getting older, the quantity and the quality of those eggs you have will start reducing. When they are reducing, your fertility will also be reducing. Okay? Yeah, Ebenezer, I'm not seeing your questions. Please, can you ask your questions again for some reason? I'm not seeing any question. Okay. Tosi is asking, Doc, can high-risk pregnant woman get COVID-19 vaccine? Okay, this is not part of our discussion today, but I'm going to provide you feedback. So this is what you need to do, my sister. Now, depending on your own criteria of high risk. So remember, there are some women we classify as high risk. So there are a couple of criteria that will qualify you as high risk. Number one is age above 35. So if you are currently pregnant and you are above 35, by standard, by default, you are high risk. Now, what does high risk mean? It means that throughout our 9 months, we have to be extremely careful to make sure we look after you and look after your baby. So by the mere fact that your pregnancy is already classified as high risk actually makes you vulnerable. So you are actually more in need of this vaccine compared to other women that do not have high risk. My sister, we've had research. We've checked women that are pregnant that got this vaccine. We've checked women that are breastfeeding that got this vaccine. We've checked women that are looking for babies that got this vaccine. And there is no evidence, as I'm talking to you right now, that says it's harmful. Rather, it's helpful. So I understand your worry if you're still sitting on the fence. But think about that. What if you get infected with this COVID and it affects your baby and it leads to poor outcome in your pregnancy? Will you forgive yourself? I understand the concerns, but there is absolutely nothing to worry about. So the fact you are high risk places you on top of the list of someone that should get this vaccine. So please go and get it. Make sure you get the 2 doses. Any vaccine is better than no vaccine. Let me repeat. Any vaccine, any dose, even if it's half that you got, you are better than someone that didn't receive the vaccine. Because if you're in America right now, we're getting ready to go to flu season. Flu season is also another worry for us. So imagine when you combine COVID and flu season and pregnancy. Okay, so please, my sister, if it's offered you, go and take them, completely safe, okay? Please keep asking your questions. Even if your question is not related to this topic, feel free to ask. But remember, the topic this evening is talking about leakage of semen and the ability to still become pregnant. And I told you guys that the jury is back and there is no connection between the two. So stop focusing on whether it's leaking or not. Just make sure you engage in the 48-hourly love making we advise. That's all you need to do. Okay? All right. So Oni NGCYN, follow us up. Ebenezer, you can actually post the email. Let me type the email for you. So just send us an email and we're going to set you up. So hold on, let me type the email. Let me type our email address for you. Okay, so when you get this email, just shoot us an email. We're going to send you the package. So that's our email, snowspirations@gmail.com. Shoot us an email. We're going to send you the packages. Then you make up your mind the one you want. Okay? All right. Do you guys have any other question? If we don't have any other question, we're going to wrap up at the mark of 20 minutes. But thank you for coming this evening. Don't worry about anything. Just relax. And by the special grace of God, you're going to be a mother. Okay? Correct. So just go and take it, my sister. Okay? Now, if you are currently pregnant, I want to believe you are in our ANC lounge. We want to make sure we attend to you properly so that you don't have complications, okay? After fibroid surgery, doctor said you have endometriosis. Though he tried removing it, you are 35, you're still trying to conceive. Please, you really need to talk to me. Please go ahead and subscribe and we can see what we can do for you. But you've taken the right direction by removing the fibroid. Unfortunately, if you have endometriosis is a factor that can also delay ability to become pregnant. Now, the treatment of endometriosis is dependent on the severity. If you have mild endometriosis, you can even complete your family without even knowing. If you have moderate endometriosis, we can use some medications. But if you have severe endometriosis, we might combine surgery and treatment. Okay, so it depends on the severity of what you have. Now you're 35, you're just right there, the cutoff point. Okay, so we need to know what we need to do. what you can do as you're waiting for all this, once your myomectomy, which is the surgical removal of that fibroid, once it's properly healed, keep on practicing your PPP. Play practice. Any woman within her reproductive phase in life can suddenly overcome infertility and become pregnant. Let me repeat again. Any woman, regardless of the duration, regardless of the cause of infertility, if she continues doing her own part, can suddenly defeat infertility. Let me give you an example. If the reason why you're not able to become pregnant is because you had mild adhesions or mild blockage in your tube, then when we consulted you and we sent you for HSG, hysterosalpingogram. Hysterosalpingogram is a special investigation that looks at the tubes to see if they are open. Because for you to become pregnant naturally, we need to make sure that your tubes are open. Now, if you have a mild blockage and before you went for hysterosalpingogram, it's stopping you from becoming pregnant, guess what? When you are done with going for your HSG, HSG is going to dislodge that tiny mild blockage. So if you make love to your partner, you can suddenly become pregnant. We have also seen women that became pregnant shortly after having failed IVF naturally. So any woman can become pregnant naturally at any time. If you have the third stage of endometriosis, that's quite concerning. So we need to look at what we need to do. Now, top on your list, my sister, you have to consider assisted reproductive technique. So you might be a good candidate for IVF. So you're 35. Hopefully you still have your eggs intact. So if you have your eggs intact and you're still having delays, then you need to consider going for IVF as soon as possible. Okay? All right. Ask your questions. For some reason, I'm not seeing Ebenezer's question today. I don't know why, but it's okay. So if you have any other question, please ask before I go. Do you have any other question? Feel free to ask your questions, okay? Any question? Let's wrap up at the mark of 25 minutes. Let's spend the next 3 minutes still providing you feedbacks. Remember, this month in our group, we have a special event, Gender Selection Super Masterclass. Gender selection simply means you prefer to have a baby boy. You prefer to have a baby girl. Probably you have 4 girls and you now want to balance your family with 2 boys. It's possible. You can suddenly, if you follow the right track, have 2 boys to add to your 4 girls. You can even do it the other way. Maybe you have 4 boys and you want 2 girls. It's also possible. Thank God for modern technologies. There are ways you can achieve this. So we're going to take time to teach it on the 26th. So register for that event and we'll attend to you as soon as possible. Yes, we have a provider in Abuja. So what you need to do is to do your own part. When you subscribe, I'm going to consult you and I'm going to refer you to a provider in Abuja. A provider in Abuja actually happens to have succeeded in so many very good outcomes. He's actually had about 3 quadruplets. He succeeded in achieving 3 quadruplets. That means 4 babies at a go. One of the women that had the quadruplets actually used 1 tube. She had just 1 tube. So with 1 tube, if you're bold enough, you can still take your bold step. Even with both tubes locked, you can still be a mother of twins, a mother of quadruplets. Okay? So take your bold steps today. Let God be God. Okay? All right. So I think we've come to the end of today's episode. Thank you for coming. Now, starting next week, we might likely change our broadcast calendar. So be on the lookout for that. We're going to do a couple of things differently. So if you haven't subscribed, please, before you go this evening, click on the subscription button. Like it, comment, ask your questions, share it with your friends, show up. For now, when you show up in the channel, review other videos we've released in the channel. Make sure you understand them properly. As you are watching them, feel free to ask your questions, and I will definitely make out time and attend to you. Thank you for coming this evening. I appreciate you, and hopefully tomorrow we'll find another important topic, and I'll see you guys tomorrow. God bless you and enjoy the rest of your evening. Bye-bye for now.